Dr. Kevin Kavanagh is a retired physician and is also the founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
I tried to watch the two town halls back and forth last night and got kind of sick of it after about 40 minutes and turned it off. But as I was going back and forth, when I was on the NBC with Savannah Guthrie and the president, the subject of masks, I don't want to make this political, but it is political, so it is political. The subject of mask wearing was a fairly big topic for the first, seemed like 10 or 15 minutes of the program. And the president was citing a study that indicated something about 85% of people who wear masks are still getting sick or something like that. And Savannah kept saying, no, you're misinterpreting the numbers. But then I never heard what her point was. Do you know about that at all?
No, I don't. It's pretty hard when people misinterpret numbers plus don't quote the study. You can't find it. I mean, I don't know. That's certainly not what I'm hearing. There's good data that wearing masks help decrease the viral spread. And he may have meant that wearing a mask may not protect you 100%. That's why you still have to social distance. But it should decrease the total amount of spread. There still may be some spread there, and those that got the virus maybe were wearing a mask, but there were still a tremendous amount of less people that got the virus. So it's kind of apples and oranges, and it gets pretty complicated. You've got to be careful with statistics, but Southeast Asia wears masks, South Korea wears masks. They've had tremendous success with this virus, and that's something our group is very in favor of, along with Senator McConnell. He stresses wearing masks. So let's wear masks.
Yeah, I'm just surprised that this far into it, we're still arguing about that. It seems to me that my mother used to have an expression about majoring on the minors, making a big deal out of some deal that's not a big deal while we're ignoring the big picture. And that's what that seems like to me. I mean,
I agree. I agree. And there's studies that are out that show that if you've got chronic lung disease, that masks, and we're talking surgical masks now, that they're not going to have a big impact on your lung function, will provide you with some benefit and some protection. And certainly if you have a lung disease and you can't tolerate wearing a mask, you shouldn't be out in public during a pandemic. So basically, shelter at home or wear a mask.
Europe is now poised to maybe have a second wave. They're not doing well generally at all. And is that a precursor to what we can expect?
Well, I think it may well be. And I think it's going to be quite difficult to be tracking the data from all of the countries because of the resurgence in the number of cases. It puts a huge strain on the healthcare system. And yes, Europe is in the cold climates right now, and we're going to be seeing increasing cases, and that's what we're seeing. And unfortunately, in Kentucky, we're seeing increasing cases.
Tell us the latest on the Kentucky figures.
Well, yesterday we had 1,200 cases. Now, of course, we've talked about this before, and we've discussed it on the show, that when you look at total number of cases, even though that's way too high, the better metric is your test positivity rate, because Kentucky's also had an increase in our testing. But unfortunately, the test positivity rate in Kentucky is also inching upward. It's 4.95%. At one time, it was down in the mid 3%. And even of more concern is that yesterday we had the greatest number of people in the hospital that we've ever had. We had 738 hospitalized patients from COVID-19. And so when you look at the metrics of hospitalization, which I think is one of the best metrics to use, and test positivity rate, our numbers are going in the wrong direction.
Here's a text from our Auto Tech Service text line, and this is the statement of the, quote, other side. I feel like everywhere I go, I see people wearing masks, and I mean everywhere, and the numbers are higher than ever. It doesn't make sense.
Well, unfortunately, we need everybody or almost everybody to buy in wearing masks. And this gentleman's probably going someplace different than I am. When I go around, you do not have the majority of the people wearing masks everywhere. And certainly when you take a look at the rallies that are taking place, unfortunately, most attendees are not wearing masks. If you wear masks 80% of the time, that will help. But if you then gather in large groups and you gather in households and you aren't wearing masks, but yet you're coming in contact with people who are not within your family bubble, you're going to spread that virus. And that's what we're seeing. So no, we are not wearing masks to the extent that it's going to cause a decrease in community spread. We need to get up to around 90% of the population wearing masks.
We see a story this morning about a Fayette County teacher that died was it in September, and they have attributed that to COVID-19 now, a substitute teacher?
Yes, and of course this goes into that opening up schools are risky and we need to do it safely. The good news is that there are some reports coming in that when you use strategies to mitigate spread, that schools can be opened up safer. And that's what we need to do. As you know, we've talked about reduced class sizes, bubbling, increase air circulation and complete air exchanges, air sterilization, and getting proper PPE equipment for teachers, bus monitors, bus drivers, etc. So if we do this, we can start opening up schools safely. And contact tracing, I would have to stress, would be important in that venue also.
Here's another text that says that person, meaning the one that texted every place he goes, it looks like people are wearing masks. This texter says that person is not over around the campus area. So apparently by that remark, I assume that around the campus they're not wearing masks as they should. Real quickly, 3 Auto Tech Service text line texts. Eric says, everywhere I go and have been, people are wearing masks. But then here's another text that says the BP on Catnip Hill has people every day without masks, and the Valero on Tate's Creek doesn't even require them ever. And here's another text that says, how old was the teacher and did they have any underlying issues? Do you happen to know that by any chance?
I do not, and I've tried to find out. Unfortunately, the story had a picture of a real young woman in a video, but that wasn't her. It was a different subject. So I don't know. That's something I would like to find out too. And as far as the masks go, again, there's a lot of mismessaging. I'm hearing this all the time. Everybody's wearing masks, so it doesn't work. Well, you just have to go outside and go around. I agree with the other 2 texts that people aren't wearing masks nearly enough. And that's what the data is showing. We're around 50% nationally, and Kentucky is lower than most places.
All right, Laura, good morning.
Good morning. Good morning, Doctor. Listen, do you think that things are getting bad enough now that we need to just drop some of the niceties on testing these vaccines and go into challenge testing with volunteers?
Well, that's an ethical.
It's an emergency thing?
Yeah, that has to do with ethics.
Volunteers that know what they're getting into.
Yeah, that's a lot to do with ethics. Challenge testing will speed the development of vaccines, but you need to realize that vaccines that are developed for this virus are difficult because, as we've discussed before, this virus can cause immunity, some people non-immunity, and in other people hyperimmunity. And the vaccines can do the same thing. So they have to be careful. And yes, challenge testing is something that can be considered, but that takes, boards of ethics, because it's not just the people that are challenged that get the vaccine. They also usually have a control group that don't get the vaccine that gets challenged. And that's where the real problem arises.
All right, here's a text on our Auto Tech Service text line that says, that's funny, this is the 3rd time I have heard recently that rallies are causing the spread of the virus, but no one ever says the protests, riots we're spreading it. This is one of the reasons people won't get on board with wearing masks. Also, maybe not everyone is wearing them, but a large majority are, yet the numbers are rising. This doesn't make sense either. Teacher was 49, by the way. Somebody wrote to us.
Well, that's good to know. And the caller is correct that whether it's a protest or a rally, if it's held outdoors, people aren't wearing masks, you're in close contact, it can spread them. And he's definitely right. It doesn't matter the reason why the event is being held. If it's held indoors, that certainly will cause an increase in viral spread. Outdoors, it will tend to mitigate it. But the most recent one that's been, I think, fairly well documented, that of the Rose Garden, was the majority of that was outdoors. You had probably one person that got in and passed the screening, even though they were asymptomatic carrier, and you had at least 11 individuals that came down with the virus. And certainly if you've got protests and they're outdoors not wearing masks, you have the same risk.
Here's another text from our Auto Tech Service text line. Numbers prove the masks do not prevent anything other than long-term respiratory problems. Your guest is just agreeing with his peers. Fear is a great motivator. I refuse to comply until there is reliable information that they work. That's from Dave.
Well, I think you've got a lot of reliable information. Go to the CDC website. They've got a tremendous amount of studies listed regarding masks. Masks have been used for eons in the medical profession and to protect patients that were either have decreased immunology, that have a decreased in lung function. If you were to go to a cancer hospital, those patients are wearing masks. I've never heard of any problem with surgical masks up until this pandemic. And certainly if you have a condition that you can't wear a mask, you should be sheltering at home.
One more before we run out of time here. Again, this is a anti-masker. Says, Jack, you talking to you, doctor, you doctors say if you're socially distanced, you don't need to wear a mask, and the whole reason to be socially distanced, you don't say that. You say you need a mask and socially distanced, correct?
Correct. It's not black and white. The mask will cut down on some of the spread. Remember, we've talked about, to be sure, you'd have to have goggles, hazmat gear, and know how to take it on and off. So the mask cuts down on some of the spread. Socially distancing cuts down on some of the spread. 6 feet for droplets, but if people are talking loudly or vocalization very strongly or singing, you may have to be further because that virus can aerosolize.
All right, we're out of time, doctor. Thank you so much.
Thank you, sir.
Great weekend. I'll talk to you on Monday.